Well, we call it delayed motherhood, and that basically says it all. Many women, especially in San Francisco, are having children later in life. In fact, the average age at one facility in San Francisco County is 34.4 years of age, and the oldest first-time mom delivered at 58 years old. Here to talk about this trend is Dr. Yuan-Da Fan, chairman of the Department of Obstetrics and Gynecology, Sutter Health, California Pacific Medical Center. Welcome to the show.
Thank you.
Give us a little idea in terms of, first of all, your background, in terms of how you ended up kind of specializing in this.
I came to this country about 50 years ago. Started to in different kind of business as a chef, and after that, at age 35, I went to medical school. And finished up my medical school in California, in Louisiana State Medical School.
Yeah.
And came to San Francisco in 1989. Since then, the last 30 years, spent all my life, all my 30 years in CPMC.
How did you sort of end up in this field and this thing? Was that something deliberate, or was that something that, as you were doing different things at the beginning, you started to find an interest in it?
And I feel like this is a very, very happy field to take care of women, to deliver a baby. It's probably the most enjoyable experience.
Tell us a little bit about the delayed motherhood syndrome here going on. First of all, how long has this trend been going on here, and is it unique to this area?
I think that's in the entire country, you know, the maternity age getting older and older, and especially in San Francisco area, we have a lot of higher educated professional person, and that was the reason CPMC has a mother having their baby in the entire country.
Yeah. Hearing about 58 years old was quite
a couple years ago.
Yeah. And of course, I have personal experience. My wife and I were older when we started to have kids, and a lot of it had to do with career and trying to be ready for a family, which is something that I think is a different kind of mentality than there used to be, huh?
That's very true.
I would think that that's an advantage for the family. So when we're talking about upside and downside, what are some of the disadvantages that maybe people face?
I would say talking about the risk. You know, when the woman getting older, try to think of the baby, from very simple way to look at that, the number of eggs going down, the egg getting older, so it's very hard to get pregnant. If you get pregnant, sometimes you have a much higher chance to become miscarriage. Even you become pregnant, and also have a good chance, you know, to become fetal abnormality.
How should people go about then trying to find out whether they're a good candidate to wait or whether they should try when they're younger?
I would say, you know, generally speaking, try to have a baby in the right age. Don't wait too late.
Oh, yeah. How do people find out the right age, though? What should they come and find out or do?
I would say, you know, in general speaking, we use 35 years as a cutoff point. Age over 35, consider a high-risk mom.
Oh, I see. Okay, so you do have a mark, 35 years old. Oh, okay. How about in the Asian American and Pacific Islander communities? Is this a trend that's different or pretty much the same?
It's very similar because CPMC, 29% of mother because Asia Pacific Islander. And we look at statistics same as everybody else. Yeah,
and when you put 35 years old as sort of the marker, you would pretty much figure then that the trend will pretty much stop around that time, right? We won't see women waiting longer than that for the most part?
Well, it depends on when a person, especially in Bay Area, and you know, most of professional women, they have many different reasons and to that and thinking about having very earlier, you know, from education, continue to pursue higher degree, continue to pursue a higher level of professional.
Yeah, and they can come to you or the Pacific Medical Center and get that kind of advice, right?
Yes.
What to do?
Yes.
All right. Is it easy to get that kind of advice? Is it easy to make an appointment?
I would say just make an appointment to our OB-GYN provider.
Yeah.
They can look at your situation, look at family background, look at your medical history, and advise you probably, you know, when's the best time to have your baby.
Yeah. I tell you what, it is quite a bit different than in the old days when people were having kids as teenagers, huh?
Yes.
Yes. But a better one, I think. Okay. Thank you very much. That was very interesting.
Okay, thank you.
All right. Well, coming up, getting young people of color into the digital field, helping themselves and their community at the same time. We look at Bridge Good next.